here. So it is my honor and privilege to be the host of this webinar with these two wonderful people. So let me introduce our people here today. Sorry, get your bios up here. So I'm going to start with Dominique Denis Lalonde. Did I do it? I hope so. All right, her is a registered nurse and educator. Her graduate research focuses on exploring how harm reduction is conceptualized and applied. Dominique's background is in harm reduction and safer drug use, HIV prevention, sexual health, LGBT health, and sex worker advocacy. Dominique has supported harm reduction efforts in a variety of roles and contexts, including at large international festivals and with vulnerable populations in Calgary. In 2020, she published a seminal article about the potential roles of nurses in the field of psychedelic-assisted therapy, and in 2021, co-authored a piece about harm reduction nursing education with colleagues in the Harm Reduction Nurses Association. She has 2 children, 1 cat, and too many plants. Welcome, Dominique. And Bryce Coach is a nurse who has experience in emergency medicine, mass gathering medicine, harm reduction, and public health. Currently, he is the Central Canada Regional Representative for Harm Reduction Nurses Association, and James will put that website in the chat for us. The Harm Reduction Nurses Association is a Canadian national organization with a mission to advance harm reduction nursing through practice, education, research, and advocacy. While in nursing school, Bryce co-founded Project Safe Audience, which is a harm reduction program that provides health services to the festival rave population. Some of the services provided are on-site drug checking, harm reduction, supply distribution, psychedelic crisis intervention, and mental health services. Bryce is currently pursuing his Masters of Nurse Practitioner with a focus on psychedelic medicine. In addition to this, he is receiving training from TheraPsil on the therapeutic use of psychedelics in palliative care. So thank you both for joining us today, and I will hand this over to you.
Awesome. Thank you very much for the introduction, and I will share my screen here. There we go. All right. So we are going to start this off with just our own personal land acknowledgements here. So I am a settler on Treaty 1 territory. This land was stolen from the Anishinaabe, Cree, Ojibwe, Cree, Dakota, and Dene peoples, and it's also the homeland of the Métis Nation. My ancestors came to Canada from Ukraine and settled in Porcupine Plain, Saskatchewan, which is located on the traditional territories of the Anishinaabe and Cree peoples, as well as the territory of Treaty 6. My family was supported by the Indigenous populations of Porcupine Plains, and I would doubt I would be here today if it wasn't for their guidance and support. As a settler, I acknowledge the harms done by my ancestors and also acknowledge that these same harms are still negatively affecting the Indigenous populations who live on these lands today. I strive towards reconciliation in my professional practice and daily life by doing my part to dismantle and abolish the racist and oppressive systems that continue to uphold settler colonial ideologies and values.
Great. Hi, everyone. I'm Dominique. I'm coming to you today from Treaty 7 land. So that's the traditional territories of the Blackfoot Confederacy, which includes the Siksika, the Kainai, and the Piikani. It also includes Tsuut'ina and the Nakota Nations. And Calgary is also home to the Métis Nation Region 3. So I'm a settler, and my ancestors were pioneers from France and very much were colonizers. And so I have to just gratefully acknowledge the people who are and who were and are continue to be the traditional stewards of this land. Through my work, it is my aim to contribute to reconciliation by looking at some of the structures that continue to marginalize populations today, including Indigenous peoples, and those including experiencing a disproportionate degree of drug-related harm.
All right. So I'll talk a little bit about the Harm Reduction Nurses Association. So I sit on the board of directors for the Harm Reduction Nurses Association as the central regional representative. We are a professional association of nurses who strive to promote harm reduction education, research, and advocacy. One of the great things about being a member of the Harm Reduction Nurses Association is you have access to a lot of our back-end presentations and information, and it's also just a great place to interact with fellow harm reduction nurses. In addition, we actually have membership for non-nurses as well, and sort of allied health, as well as students as well. So if you're interested in the field of harm reduction, whether you're a nurse or not, I highly recommend you check out our website there and see if it resonates with you. So I'll hand it over to Dominique.
And if some of this content interests you and you want to hear more about it, there is a huge amount of webinars available on the HRNA website that I would highly recommend. So let's get started. I want to start by reading this quote. Harm reduction is that most unfortunate of beings, a term in search of a meaning. I felt this was a really good quote, despite having been written over 25 years ago. And it sums up why I decided to study the conceptualization of harm reduction as the focus of my thesis, which I happen to be defending in 2 weeks' time. So that's all I've been thinking about lately. In the various harm reduction-esque environments that I have worked in, the term harm reduction seemed to mean different things to different people. I was noticing that it started to become a buzzword and didn't have any clear, consistent meaning. And as someone who's an advocate and an educator in the field, this intrigued me, but it also frustrated the crap out of me. So I wanted to learn more about how people think of harm reduction, what it has meant over time, how that's evolved, and how it can be applied in various contexts. So I feel like a lot of people claim to know what it's all about, but we're not necessarily all united in that. So I'm going to provide a bit more context around harm reduction here, but I do want to put it out there that this discussion that we're having today isn't meant to be prescriptive. It's not, we're not here to tell people what to do or what not to do. Our aim is to invite you to consider psychedelic assisted therapy through a harm reduction lens, and hopefully explore some ideas in the process that inspire you and fuel your interest in psychedelic therapy. So first, I want to provide some context about harm reduction. Next slide, Bryce. And what I'm sharing with you today is part of an evolutionary concept analysis I undertook a few years ago. I won't bore you with the methodology, but some colleagues and I undertook this to understand where harm reduction came from, where it's been, and where it might be going as a concept. So this allows us to honor the history of it, as well as to recognize how it's changed over time, and also to apply it to new areas going forward as well, such as psychedelic assisted therapy. In the spirit of the holiday season, since we're now in December, you're gonna hear me talking about the spirit of harm reduction, and we're gonna go through the past, present, and future of harm reduction. And then I will turn it over to Bryce to take a closer look at harm reduction principles and how we can apply them to the field of psychedelic assisted therapy. There's a surprising amount of crossover between harm reduction and psychedelic therapy, since they obviously both relate to psychoactive drug use, but also because their focus is on health promotion and individualized, person-centered care, amongst many other things that we'll discuss. Next slide. So let's start with the spirit of harm reduction past. So I suspect many of you are familiar with these ideas. So here's a little recap about harm reduction's past. The earliest example of harm reduction dates back to the 1920s with physicians who were prescribing opioid replacement therapies to people with opioid dependence. It wasn't until about 1990, however, that the term harm reduction was actually coined. Of course, harm reduction has very deep roots in the HIV/AIDS crisis and movement, so particularly with the establishment of needle distribution programs in the 80s. And HIV activism and harm reduction during that time was very, very grassroots and somewhat anarchistic. Drug users were seeing that their community was struggling, and so they began supplying sterile injection supplies, from their backpack without government support or funding or anything. And that anarchist practice was later institutionalized as public health policy in Canada anyway, not globally, that's for sure. And since then, we've seen several other anarchist harm reduction strategies that then become government sanctioned, such as supervised consumption services, or you may know them as safe injection sites, and also naloxone distribution. So naloxone being the opioid antidote medicine to prevent opioid overdose. Of course, some of these strategies are still very controversial and political. So as an Albertan, it's pretty clear that harm reduction is under attack from our provincial government. And we're still advocating and fighting for these services, which have been around for quite some time and for which we have ample evidence of their effectiveness. So this should really be in the past, but unfortunately, the past just keeps coming back. Bryce, you can click again. As a result of these ideas and strategies that have happened, we have noticed there have been many well-established outcomes, including reduced transmission, impact of HIV/AIDS, and hepatitis C. Of course, people who use drugs have stopped dying at the same rate until the opioid crisis anyway. They can experience better health, they have better access to services and treatment should they choose treatment. And very importantly, there was a enhanced capacity to organize in terms of advocating for the health and human rights of people who use drugs. So that's often willfully forgotten, I think, but harm reduction set a precedence that drug users did what they knew was going to be best, regardless of who did or did not approve. And this is a strength of harm reduction, for sure, but it also presents challenges for others to support harm reduction, especially folks who are very keen to do things, by the book. And what I mean by that is that harm reduction has historically meant doing things without permission and then maybe asking for forgiveness later. As such, the innovators in this field have come up against significant pushback, and this continues today, especially in Alberta. So does this sound familiar, Are there innovators in psychedelic practice that are experiencing pushback? You betcha. And it might be less than they previously have, but just like harm reduction work, it really isn't for the faint of heart, I think, especially not in these early days anyway. Now we're going to take a look at the spirit of harm reduction present. So when we consider where harm reduction is today, thanks, Bryce, most people acknowledge now that drug use and addiction are complex, multifaceted issues, and they're not a result of moral deviance or spiritual weakness or anything like that. There's also now a focus on becoming more aware of how stigma affects people who use drugs. We've also, I think, been made very clear that the war on drugs and drug prohibition are total failures and have actually just increased drug-related harm. And now that we have a greater emphasis on mental health awareness and on trauma-informed care, there's also increasing awareness and acceptance that people who use drugs do so for a whole variety of super valid reasons. And as a consequence, it's not a one-size-fits-all approach to reducing harm that's going to work. Not everything works for everyone. So you can click, Bryce. Where we are at, I believe, with these ideas is that there's now a tremendous amount of work being done to reduce the stigma of drug use and a shift from that abstinence-based messaging about drug use to more fact-based information. So I think we are hopefully past the just say no era and more into an evidence-based, fact-based drug information era. In addition, drug policy reforms are being presented, discussed, and some successfully passed, such as like cannabis legalization and the decriminalized nature movements. Of course, there are always delay tactics. For example, we have lots of evidence for harm reduction, but there's always delays and people trying to reverse course. So, for example, a supervised consumption service can be asked to do multiple environmental scans to make sure it's the right thing for the community. Often there are multiple committees created at all levels of government to try and find out if this is a good idea. And this is all under the guise of hopefully making better decisions, but often they're just delay tactics. Yeah. Does that sound familiar? It might sound familiar in the psychedelic world as well. So finally, just this last point here, it is as a result of where harm reduction has come, it's my belief that these ideas also pave the way to some degree for reviving psychedelic assisted therapy and research. Drugs and the people who use them are no longer social pariahs. And the innovative idea that currently illegal drugs might have therapeutic uses becomes a bit more palatable. So this is me giving a nod to drug users of the past and present, and those who've been involved in harm reduction over the years. By doing what you do and being who you are, you've changed the narrative and the social landscape in a way that has made psychedelics a little bit less far out. And for that, can't say thank you enough. Now let's move on to the spirit of harm reduction future. So this is unwritten. This is not pulling from literature, of course, because it's the future. And I want to think, what might happen next? Where can harm reduction as a movement go? Where do we want it to go? So these are some of the newer ideas I am seeing coming up related to harm reduction. Now, they might not seem bold to this audience, but I can assure you that to the general public, these are some really bold ideas. So first, what if we acknowledge that drug use is a very normal human thing and always has been? How about the pursuit of pleasure, with or without drugs, being a human right? This becomes now about liberty, autonomy of one's body. How about admitting that any and all drug use can be both harmful or beneficial, including the more stigmatized drugs like, say, meth or heroin? How about a focus on bodily autonomy and the right to get high? Maybe some of you may have attended the Harm Reduction International Conference online festival last week, but there were many sessions. It came up in a lot of sessions where the panelists were exploring the role of pleasure in harm reduction. And I was really glad to see that conversation happening because I feel like that's pretty new, but it's very important. So with these ideas in mind, it follows that drug use should be as safe and beneficial as possible. Now, I get that these are uncomfortable ideas for many people, especially those who've maybe experienced drug-related harm themselves, or perhaps the death of a loved one to drug use or something like that. So, it's okay to feel uncomfortable with these ideas, but that's why we're talking about it. And I really think I want to emphasize that we need to stay balanced when we talk about the role of drugs in today's society, rather than, creating false binaries about some drugs being good and some drugs being bad, and picking sides. Bryce, you can click. So with these ideas, I think a lot of things become possible. We can start to see different sorts of drugs and methods of use, not as better than another, but rather on a multi-dimensional spectrum, which includes everything from like indigenous traditions to rave culture, to psychedelic clinics, and also to prescription heroin. This, reconciling or bridging of human drug use is key to reducing stigma and also dismantling systemic oppression that is experienced by many people who historically have used drugs or people who use drugs today. Perhaps you, someone out there in the audience, enjoy taking psilocybin and listening to music alone. Another person might be inclined to use this drug as medicine to heal themselves with or without the help of a therapist. Some indigenous cultures prefer to use it in a ceremonial group setting, whereas someone might take some for the very first time at a festival with some friends. When we stop labeling any of these uses as better or worse than another, we can better assess the risk in all of those situations and apply harm reduction strategies as appropriate to not only reduce harm, but also enhance and maximize the benefits for that person's drug use. Of course, if we are going to acknowledge these ideas about drug use, we also should talk about the fact that a huge amount of our drug harms come from our bad drug policy, and that we need more sensible drug policy. So for example, a safe supply of currently legal drugs would go a long way to reducing drug-related harms. And there's a ton of advocacy happening in this direction. but we've yet to see any significant movements from our governments. It's great that GMP psychedelics will be increasingly available to researchers and therapists, but we need to remember that most users of currently illegal drugs rely on the underground market, and it is unpredictably toxic. So the future of harm reduction really is in advocating for safe supply and drug policy reform, ideally so that there becomes very little harm reduction to be done, right? That we work ourselves out of a job. That's the point. So lastly here, I think this naturally brings us to a place where the therapeutic use of illegal drugs, currently illegal drugs, maybe one day they won't be legal, but where that psychedelic therapy can become mainstream, accessible, and accepted to more people than ever before. The concept of harm reduction has enabled some complex progressive shifts in the minds of politicians, researchers, and the public. However, I think we really need to still stay vigilant to the media's portrayal of drugs and the people who use them, and avoid that divisive, stigmatizing ideas there, where you have a good drug user, you know, this type of drug use is good, and bad drug users. Or, you know, some drugs are good, some drugs are bad, or some drugs are natural and some are not. These are all really false dichotomies, and they're doing a disservice to the harm reduction movement and also to psychedelic assisted therapy. Like so what I'm trying to say is that if you're in support of psychedelic therapy and you want it to become more acceptable and accessible, the past, present, and future of harm reduction should also matter to you. So with that, I'm going to get off my soapbox, and I'm going to turn it over to Bryce to take us through some principles of harm reduction and how they can be applied to psychedelic assisted therapies.
Thank you very much for that, Dominique, and taking us through the ghosts of past, present, and future harm reduction. Very spooky.
I chose not to say ghosts because I felt like that was like too spooky and
fair, yeah. You know,
so
we passed Halloween already, you know,
yeah,
so
exactly.
that's fair. All righty. So we're going to talk a little bit about harm reduction and what exactly is harm reduction. I find it's very complex and multifaceted. There is a lot of definitions of what harm reduction is. Some of them I think are really good. Some of them I think are not that great. When it comes to my own personal definition of harm reduction, I like to use sort of the KISS method, the keep it simple and stupid. And so what I like to say for harm reduction is you take something that has harms associated with it, such as substance use or driving your car, and you reduce those harms in a way that doesn't stop the original behavior. So when it comes to substance use, we can access safe supply, use safer injection equipment. When it comes to driving our car, we can put on a seatbelt. You know, our cars are these death traps. We drive them to work every single day. We're not going to stop driving our cars just because it increases harms to us. So we take harm reduction techniques such as wearing seatbelts, driving the speed limit as a way to reduce our harms without having us to stop driving. And that's one thing I think is really cool about harm reduction. A lot of this will be very focused on, you know, substances, but the principles of harm reduction can be equally applied to many other different behaviors in life. And I'm sure many of you in the audience actually participate in harm reduction without actually realizing it. So for the principles we're going to be going over, I like the principles from the National Harm Reduction Coalition. So their website there, they have around 8 principles in total. I'm going to be mainly focusing on the ones that I think directly apply to psychedelic assisted therapy. And like Dominique said originally, I'm not coming in here telling you this is how you should be running your practice. These are just things for you to think about as you go forward in this space. You know, it's great in the psychedelic space to always reflect on your practice and see, you know, am I doing good? Or am I promoting any harms? I think that's just an important reflection to have with working in any of these spaces. So for the first principle, accepts for better or worse that licit and illicit drug use are part of the world and choose to minimize its harmful effects rather than simply ignore or condemn them. For ever since we've been recording history, we've been getting fucked up on all different substances. There are cave paintings of, mushroom shamans. We've been putting things into our body to try to mess with our brain since we've figured out that we were able to do. And that's okay. We should be allowed to do that. We have these receptors in our brain. We should be able to access them. They are part of life, and they're part of how we should be able to enjoy our life. And so we're not going to be able to legislate our way out of this drug problem. We're not going to be able to stop drug use. This is something that has been a part of us for a long time. And when it comes to psychedelics, we're not going to be able to, always create the best and safest places for people to use psychedelics, and that is okay. There are some psychedelics that, people choose to take with a guide, but there's also, that's not the only way to take a psychedelic. There is people who take psychedelics at music festivals, and that's okay. There's people who take psychedelics to paint a beautiful mural in their house, and that is also okay. All these different types of drug use and psychedelic use are valid and should be allowed. What this also means is that as psychedelic therapists, you may have clients who come into your practice that may not be suitable for psychedelic therapy and may seek to do psychedelic therapy outside of a therapist setting. These people also need to be supported because we just can't say no to them. People are going to modify their psyche in any which way that they can, and they should be supportive in that way. And part of this as well is also not to demonize non-medical use of psychedelics. As someone who comes from sort of the rave and music festival population and kind of moving into this psychedelic space, psychedelic assisted therapy space that I'm sort of finding myself in, I'm finding there's a lot of sort of demonization of experience from that sort of side of life that, that's just sort of the wrong way to use psychedelics. And I don't think there's a wrong way to use psychedelics. I think all sort of use is valid. So we should support people on their non-medical journey just as much as we support people who are using psychedelics for medicinal purposes. The second principle I'm going to be talking about is understanding that drug use is a complex, multifaceted phenomenon that encompasses a continuum of behaviors from severe use to total abstinence, and acknowledge that some ways of using drugs are clearly safer than others. People use psychedelics for many different reasons. People use psychedelics to gain a different perspective on life. Other people use it to get fucked up for a little bit and stare at the walls melting. And both are completely valid usages of substance use and should be allowed. But that being said, there are some ways that do increase harms associated with the use. For example, I went to a presentation that they talked about using psilocybin with an MAOI. And for people who don't know, an MAOI will enhance the intensity and the duration of the effect, but it also can increase the sort of toxic effects associated with it. And so part of harm reduction is acknowledging that there are sometimes safer ways to take substance use, and just knowing what you're sort of getting yourself into. And there's also that comes to as well as sort of the roots when it comes to using different substances. We can take ketamine as an example of this. So when used as an oral lozenge, it takes a decent amount of time to enter the bloodstream. However, when taken intramuscularly, the onset is rapid and can be intense. And so you got to be careful, especially if you're changing your route of your substance use or combining it with something else, because that can affect how that drug works on your body. All right. Number 3, establishes quality of the individual and community life and well-being, not necessarily cessation of all drug use as the criteria for successful interventions and policies. Getting people to stop their drug use or stop their illegal behavior isn't the goal of any harm reduction intervention. What harm reduction is trying to do is for people to gain a better relationship over their substance use. For a psychedelic harm reduction program to be successful, they need to acknowledge that people may be under the influence of other substances while taking psychedelics. With a couple presentations I've been a part of and a couple people I've worked with, there are places that require you to be completely abstinent from all substances before you go into a psychedelic session. I can understand why that might be a requirement for some practitioners, But if you have someone who, uses cannabis every single day or uses caffeine every single day, that is their baseline. And to have them abstain from that substance can increase harms to them. They will come into the psychedelic assisted therapy at a different state than they're normally familiar with, and that can cause some issues. And so, having a discussion with the clients about, what this whole session looks like and why you ask people to abstain from it, and maybe, having some wiggle room around when it comes to working with clients who, use substances daily, and that's just a part of their daily life. You don't really want someone going through withdrawal during their psychedelic assisted therapy session. That would lead to a pretty poor outcome. This also relates to using community as a form of harm reduction. With my own harm reduction program, Project Safe Audience, we have built this community of ravers and festival goers that supports each other. And our project has turned into more than just a direct service provision, where we do provide services at the events, but we have a team and a community that works with us, that reaches out in the crowd and finds people who are having difficult times and brings us back to our PSA booth. And so you can do sort of a similar thing within psychedelic assisted therapies as well. You can build this sort of community of practice, other peers, other people who use substances, or other practitioners, and sort of work together in reducing harms towards your patients. That can work to help reduce some of the harms. One of the big things in medicine now and nursing is trying to break down silos. I think that's important in psychedelic assisted therapies as well, is trying to break down these silos and sort of meeting together and talking together and consulting with each other, so we can all work together to have the best patient outcomes. In addition to this, I think as well as we need to all sort of work together on reducing barriers to accessing psychedelics. It's my opinion, unless there is a medical contraindication, such as sort of a heart condition, psychedelic use should be allowed. I have heard some amazing stories from people who wouldn't fit the sort of perfect patient criteria for a research study, but took psychedelics and had amazing outcomes. When we sort of see these research papers coming out about psychedelics, these are the perfect patients. These people have been, checked for all sort of health conditions, and so these are the best case scenarios. However, I don't think the best outcomes can sort of come from that population. There are individuals who, have mental health conditions that could really benefit from psychedelic use, and we shouldn't exclude them from this space. And so working together with your clients to find a therapy that would work with them, or a psychedelic that would work with them. And I think we should be all working together to try to expand the use of psychedelics. So 4, cause for the non-judgmental, non-coercive provision of services and resources to people who use drugs and the communities in which they live in order to assist them in reducing harms. And so one of the big things here is around person-centered language. One little thing, a bit of a sad note, that the van that's pictured there, this is actually a harm reduction van that was purchased in Calgary. However, it is sadly not currently operational. It's not being used, even though it is an amazing intervention. But yeah, let's talk a little bit about language and why it matters, and why we need to be cautious about how we say things. You may hear as I'm talking, I usually use the term people who use drugs, because we are people first and we are substance use after. So language matters. You want to be using persons first language as much as possible. Instead of using terms such as opiate user or addict, you can use person who uses opiates. Instead of psychedelic user, person who uses psychedelics. And using language that reflects the medical nature of the substance use. Instead of calling people abusers or junkies, Winnipeg, meth head tends to be a very popular derogatory term that's used. Use more of that person-centered language, so person experiencing problems with substance use. You can also use these terms to describe other health conditions beyond just substance use. In my professional practice, I use this terminology to describe people living with diabetes and people living with hypertension. And this can help sort of affect that sort of self-fulfilling prophecy. If someone just keeps thinking themselves as a abuser or a junkie, it's going to sort of feed into that cycle of, substance use disorder. But we got to remind people that they are a person first and they are their condition second. And so using that person first language can go a long way in helping promote that. Number 5, ensuring that people who use drugs and those with a history of drug use routinely have a real voice in the creation of programs and policies designed to serve them. If you're going to be working with people who use drugs, you should include them in the creation of your programs. Too many programs miss the mark by not including people with lived and living experience in substance use. There's multiple different harm reduction organizations that I have worked with where they have all come out with some great ideas, but they have missed the mark because no one on the team had ever used a substance before. And so they enact policy and procedure that increases harms without, with trying to think that they are saving this population. Creating a community of people with lived and living experience in substance use can help a lot in directing your program into taking a more harm reduction stance. And this also helps prevent the problem of having too many saviors in the room. And so try to include people who use drugs in any sort of program that you are working with. And one interesting thing that is coming out now is sort of this patient-oriented research in psychedelics. So people who are being researched on are included in how the research is done on them, because they're the one that the information is going to most directly apply to. So they should have the most input into how this research done. And so I believe Pam was talking about in another meeting about some grants that are actually being given out in BC for this patient-oriented research. And I think that's amazing. All right. Number 7, recognizes that the realities of poverty, class, racism, social isolation, past trauma, sex-based discrimination, and other social inequities affect both people's vulnerability to and capacity for effectively dealing with drug-related harms. One thing that's really bothered me in this psychedelic space is accessibility. Currently, the only people who can access psychedelics, or at least psychedelic assisted therapies, are people with the means and finances to afford these medicines. Some programs are asking upwards of $2,000 for a single session. That blows my mind. That's very inaccessible for a large portion of the population. And most importantly, it's inaccessible for a population that could get the most benefit from these therapies. And so I think we all have a duty to try to increase accessibility and try to make this more accessible for all populations. And by making it completely inaccessible for people who need it most, we are increasing the harms towards people who might be, experiencing poverty. In addition to this, practitioners need to acknowledge that they may not be the right person to treat a certain population. For example, if you are a white individual, you may not be the best practitioner to treat racism-based trauma. As a practitioner, you need to sit down and reflect on where your biases are and where your perspectives are. And, acknowledge that you may not be the right person to treat this individual. Trauma-informed care is important. Before working with someone who has a history of trauma, practitioners should reflect on if they feel they'll be the best person to unpack these feelings. Once you open Pandora's box, you can't really get it back in. And so practitioners need to reflect if they have the skills and the abilities to treat certain traumas. Within nursing, we have something called scope of practice. And it's drilled into our heads to not move beyond what our scope of practice is. And nurses go through a lot of self-reflection around, am I the right person to be doing this? Do I have the right skills and ability to be treating this client? And if we don't, we are tasked to reach out and find someone else who would be better able to take care of this practice. In addition to this, one of the models that comes with psychedelic assisted therapies is around these dyads of practitioners working together. And practitioners should reflect on if their the therapist team is right pairing to support the client's specific needs. For example, if you're working with someone who identifies as LGBTQ2SQ+, it's, you may want to reflect that you have someone on your team that can properly support someone through that, who has experience in that, or, is knowledgeable enough to support that client if they have any, traumas that come up from their expression. And so these are some of the principles of harm reduction. I hope all of you check out that website that I posted originally at the start of this to go through all the other principles and do some reflection on yourself and see, what might I be doing that might be increasing harms to my clients as a therapist? Am I, reducing accessibility to psychedelics? Is requiring my patients to find psychedelics on their own causing them to increase harms? Because like Dominique said, we have a toxic drug supply, and requiring clients to go find their own psychedelics to use in the clinic increases harms to them. It may decrease harms on the practitioner, but it increases the harms on the clients. And so I hope you use these principles to reflect on your practice and maybe make some changes moving forward. And so we actually have some bit of guided discussion now. We have some talking points that we were kind of going to go through and sort of have a bit of a discussion about some of the nuances of harm reduction and how it applies to psychedelics as a whole. I'm going to pull up the Q&A on my side. I actually can't see it here. See, there's some questions. There we go. Okay. There we go. So how much evidence is enough? So one thing I want to bring up in this, and Dominique kind of mentioned it in her part there, is needing multiple environmental scans to get a safe consumption site off the ground. That's actually a thing that's happening in Winnipeg right now. We are one of the few provinces that has never had a safe consumption site. Our safe consumption sites tend to be these bathrooms that are in health clinics, but they are all under the table. And so we've been trying for many, many years to try to get a safe consumption site here in Winnipeg. And I think we're on our third or fourth environmental scan on around if a safe consumption site will be good for the population. And time again, it shows that yes, a safe consumption site would be beneficial to the population. And continuously, provincial leadership has been like, you know what, I just don't think there's enough evidence. It's, I think we got to look at this a little closer. And so how much, and we can kind of talk a little bit about the psychedelics, how much evidence is enough? When do we stop these delay tactics and just, let people use them?
Yeah, I just want to add in here that I think we, as healthcare professionals anyway, I know we always harp about like evidence-based practice. Everything has to be based on evidence. You have to have a rationale and it has to be backed by sound evidence. And that's really putting like a heavy focus on quantitative research, which is very important. But often that kind of research hasn't happened yet. And in some cases is really difficult to do. So I kind of feel like we should be switching our language a little bit to like, I don't know, an innovative practice, a promising practice, something that is showing, preliminary positive evidence or something like that, to sort of demonstrate that we can't always have the evidence base that we want. And if we had to wait for it, we would never get there, right? So it's almost like in the spirit of harm reduction, someone needs to start doing it. Like for example, I hope I don't butcher this, the Victoria Safer Initiative, who's providing some safe supply options to to people who use drugs in Victoria. And they're collecting data and they're making the evidence for safe supply. And that kind of needs to happen, even though that's probably rubbing a lot of people the wrong way.
And even on the more like, sort of like by the seat of your pants side of it, there's also Dolph out in that area too. That is just, they have like crowdfunded meth, heroin, and cocaine samples and have distributed them freely in the downtown east side. And I think that's great. I don't think policy is keeping up quickly enough. I think, people who use drugs and people involved in harm reduction need to sort of take initiative. And, if policies aren't there to support the practice, but we know it will benefit the safety of our clients, we should just sort of move forward with it. And it's interesting with this whole safe supply sort of talk too. We have We have places in Winnipeg that have started doing, we've had nurses sort of accessing safe supply for the clients to help have them stay in COVID isolation centers longer, which I think is great. You know, we acknowledge that by leaving the COVID isolation center, you're increasing harms. And so let's get you your drugs here. Let's get you here to stay here as long as you can and wait till your isolation services are over. And I think that's great. But yeah.
Pam, do you have anything that you want to chime in about that?
Well, yeah, we had a great conversation beforehand when we were getting ready for this webinar is how much evidence is enough. And I think, in some cases, what you just have to move forward is with evidence-informed decisions. So you may not ever get a definitive answer. And the reason for that is even if we run the best clinical trial, some people will still be excluded, period. That's all there is to it. And thus you don't ever have evidence for that person or those people, or that maybe people of a certain ethnicity were not included or didn't qualify for this study, or the study was done in Korea and doesn't really apply to maybe if you're from the continent of Africa, right? So what we have to do is really be okay with evidence-informed practice and know that we will never know everything. That's how science is. It's a constant step forward. Learn more, build on that, learn more, build on it. And we have to be okay with uncertainty. Otherwise we're frozen with inaction, and we can't do that. That's just not an option.
Yeah. And like you mentioned before in the discussion, that can be used as like delay tactics too. It's just, if we may not ever get that perfect evidence there and everything, but people will use that against us and try to keep policy from moving forward.
But even on the one other thing that we did talk about too, that it's even the dollar. Like, even if you don't believe in a progressive policy, even if you do not believe people have the right to their own consciousness or the right to do with their body what they want, there is still a financial argument that has been solidified in the numbers that by having harm reduction policies, we save the healthcare system lots of money. So even if you just don't want to pay a lot of taxes, that's a good enough reason to support harm reduction, because your taxes will go down because healthcare costs do go down with good harm reduction.
This is something that I often bring up in my teaching as well, is, even if you value money above the lives of people who use drugs, which you probably wouldn't admit to, but a lot of people do, realize that, for example, a new sterile needle, for example, is less than 10 cents a piece, probably even less now. But a new HIV infection is going to cost the system upwards of $1 million over that person's lifetime, right? So like the cost benefits are obvious as well if you're going to look at it from a money standpoint.
Yeah.
And there's a comment here. Sorry to cut you off, Bryce. There's a comment here that's saying, what needs to happen. Advocacy, absolutely, at every level. Be willing to have the conversation around dinner with your family or your friends. Write a letter, like actually write a handwritten letter to your MP or MLA and say, I support this. It doesn't have to be a long letter. It doesn't have to be filled with a whole bunch of stuff. Just say, I vote and I support this. I would like you to as well. It's simple things like that, speaking up, having the conversation. Honestly, I know a lot of people that are in politics. They are really lovely people and they do want to hear from you. So let them hear from you. And once they know it's politically safe, they will move forward. So don't ever be afraid to advocate for what you feel is right. It's important. That's why we live in a democracy, so that we can advocate and speak up. So take that power and use it inspirationally.
Awesome. So I think another discussion point I would like to kind of talk about is whose harm are we actually trying to reduce here? And it's something that I've kind of seen a little bit in some of this psychedelic assisted therapy sort of space. Whenever possible, we should be trying to reduce the harms that our clients are experiencing, not the harms that our practitioners are experiencing. Our practitioners come from a level of privilege and power. And so we should be doing our best to not offload the risks of ourselves onto our clients. And one of the ones that I like to kind of talk a little bit about this is some psychedelic programs that sort of operate under the term of harm reduction, under the umbrella of harm reduction. They sort of acknowledge that people are going to use psychedelics anyways, so they should just go use it in my clinics. And yeah, that's true. People are going to use psychedelics anyways, but by requiring people to access supply on their own, that increases a lot of harms on them. It's by not providing the psychedelic to the clients, you're reducing the harms for yourself as the practitioner, but you're offloading those harms onto your clients, and they now have to go find their psychedelic on their own and access that toxic safe supply, where more likely the practitioner probably has access to a safer supply. And so while this does prevent harms towards the therapist, this model requires clients to source their substances on their own. It'd be great if we had this sort of big safe supply that we could provide to all of our clients and it was all legally available to, but that's currently not in the place that we sort of find ourselves in. So trying to work with your clients as much as possible to help them access the safe supply as easy as possible. Cool. All righty. Next one here. It's talking a little bit about calling in and calling out versus calling out. So what happens when something goes wrong? Recent public articles seem to paint a picture that the psychedelic field has a dark shadow on it, and reports of sexual assault and inappropriate behaviors are starting to come out. So how do we deal with this? How do we deal with these behaviors and these reports coming out?
Well, I can jump in a little bit on this. I know that there's international collaborations happening across North America. There's already the Guild of Guides in Europe. There's a Guild of Guides forming in Canada. There's also a number of really great documents being put together. And documents aren't enough. You have to really, I think most people are going to be, most therapists are fantastic. And I think we're talking about very few people that actually have harm. And so the question is what are the solutions? We know what the problems are. And I think we'll get much further along the road if we really focus on what are the solutions. And I just want to speak, I'll hand it back to you guys, but I just want to speak to one thing that we do already that is easy for everyone out there that's working with psychedelic medicines to do right off the bat, or any harm reduction. So as a physician, I belong to professional accountability groups, where we meet as professionals and we talk about challenging cases and teach each other and learn from each other so that others won't have problems. Like, so that you can learn, if I have a very difficult session with somebody, that I get to share that openly, honestly, and vulnerably, so that others who are maybe in that situation sometime in the future can learn from my situation, or we can ask questions and learn from each other. And I highly recommend that happens completely in all of our therapy levels, whether you're a regulated professional or you work underground. You must be in part of a professional accountability group, or a part of an accountability group or a guild or a group of guides or something where you guys can talk and really share resources, share knowledge, and share science. Science is important. I shared with Bryce and Dominique on the pre-calls that, I help a lot of underground integration specialists understand pharmacology, because it's important. They have to know pharmacology to make sure that the medicine they're giving to their patient is okay with the medicines that patient happens to be on. And these are simple things to do. And so better together, where you are always better in a group, you are always better in community and in a place that will hold you accountable. I'll go on mute.
No, that was great. That's very relevant. In the spirit of harm reduction, I feel as though we have to be really careful to not be divisive within our own communities. Certainly, mistakes are going to be made in especially in a new innovative field. We've got practitioners that are coming from all kinds of different backgrounds and professions. And so we're going to learn things, and some people are going to have to learn things the hard way. And that's okay. And what we need to do is the whole idea of calling in is so that we can all learn from those mistakes, because I suspect that most of the people who make errors in practice, they're not doing it with malicious intent, right? They're doing what they think might be appropriate in that moment. And then upon reflection, it might not be. And so if we can bring that in and let's talk about it, let's debrief about it and what we can do better going forward, that helps not only the practitioner that may have erred, but it helps everybody, right? To avoid kind of those same issues. Now, if it's a situation where there is malicious intent or a crime was committed, I mean, we have laws for those sorts of situations. So I think as much as possible, we should try and rely on our community to kind of work through these issues as much as we can.
I think also just getting comfortable with talking about the uncomfortable too. I think too often we try to hide that because it's uncomfortable. We don't want to talk about it. But, you know, there's sometimes people in different spaces that don't have the best interest in their clients. And we need to, you know, be able to be comfortable talking about that and working with our fellow practitioners to try to, you know, make this as safe as a space as possible.
I agree. Yeah. And the calling, I totally agree. There's a really good book. I don't know if I have my thing here. One of the, I can't remember her name, preeminent authors in ethics. And what she highlights over and over and over in her book, I'll find it and I'll post it in a moment, is that the people that are often most at risk is the people that care the most, and they cross too many lines. And so again, that just goes back to, we need to work in community. We need to work in accountability groups. And there's a question here, like, what do you do if you've been harmed? That's a great question. What do you do right now when people are working with medicines that are not yet legal? What are the remedies, right? How do you bring that forward? How do you go forward to someone and say, I was working with something that wasn't legal and I was harmed, right? It's a real challenging thing. And the CPA takes this very seriously. And I put in the chat, we are working on documents right now. We have been actually working on it with ethicists and guides and professionals and underground therapists really across Canada to put together some really great documents that can help guide you. So how to be, you know, a top-notch ethical therapist, how to find a top-notch ethical therapist, how to find a top-notch group. Like, we know by shining the light on what is the best, what is high integrity, that's where you want to go. That's where people will go. And then you'll have a checklist and be able to go to that person you might work with and go, let's make sure you're up to snuff here. Additionally, there's stuff like the North Star Pledge. People can look that up. It's, you know, a voluntary pledge. Everybody on the CPA, all the board members and the volunteers have all taken the North Star Pledge. And we need to do more. And we recognize that, and we're leaning in. So calling in all solutions. Absolutely.
Excellent. All righty. Let's get to the next one here. There we go. So psychedelic elitism. This one kind of makes me chuckle a little bit. I once was talking with a therapist friends of mine, and they once told me that they said, like, oh, I don't use drugs. I just use psychedelics. I was like, still a drug, but you know, and you know, it kind of goes down to, it kind of speaks to some people's beliefs that there are better drugs out there, that certain drugs are better than other drugs, and other drug use is more valid than other drugs. And what this does is it leads to stigma towards people who uses drugs. You know, natural drugs are not better than synthetic drugs. They all modify our psyches in different ways, and they all should be valued and you know, equal within this whole sphere of substance use.
Yeah, I think this is really interesting because I'm not on mute. It becomes more about, like, humans are just so bad for this. They just constantly want to put themselves above other humans, right? Like, I only use this kind of drug in this particular setting, and therefore I am better than this other person who might use in this fashion. And it's just really not doing any good for anyone. In fact, it's a disservice to both of those people, because they are now becoming two separate spheres where they might actually have a lot in common. And yeah, again, from like a harm reduction perspective, all drug use carries potential risks and harms. And anyone who's using drugs needs to realize that, even if, you know, you're using your psilocybin surrounded by angels or whatever, there's still risks associated with that, right? That might be less obvious than injection drug use per se, but we still need to recognize that all drug use carries risk. And so this elitism minimizes that and kind of prevents that discussion from going forward.
I think on the flip side too, as well, as all drug use carries risks, but all drug use carries benefits. My main job here in Winnipeg is working with people who are experiencing homelessness. And a lot of the population I work with are people who inject meth. And for when I first got into that position, it took me a little while to like try to get my head around. It's like, what's so great about meth? What are the benefits you're getting from it? And my clients were telling me, if everything that you own is in a bag, you want to do everything you can do to protect that bag. So if you fall asleep, you're not going to be able to protect that bag there. And so clients were telling me that they were using meth to stay up so they can actually protect their belongings, and they can, have a bit of a faster reaction time if they're feeling like they're threatened. I had one of my clients who told me he taught himself how to read on meth. And so I was like, that's excellent. That's great. I'm happy about that. And so, while they all have harms and risks, they all have benefits. We all use drugs for some reason or other.
So there's actually a question I'll pose to both of you that kind of goes along with this theme. One of the questions from Douglas, thank you for asking this, is what can we do on the political front to depolarize? Because that kind of falls into this. So.
And I think that question was specifically depolarize harm reduction. Correct?
Exactly,
yeah.
As a point of political leverage. But I think it kind of falls in here, like how do we depolarize these sides and see them as more of a continuum or a circle?
I think it depends on your audience, like, I guess, do you actually mean politicians? Because there's, as Pam mentioned, there are avenues where you can talk to your politicians. But if it's more trying to change the social narrative around some of these issues, you know what, just by being informed and by being willing to talk about it and to call in stigmatizing ideas, language, that actually goes a really long way. Another strategy that I think we could do better, could do more of, is coming out of the psychedelic or drug use closet, right? Folks with a lot of power and privilege are it's not necessarily safe for them to come out as drug users, and so they don't. And that just further reinforces stereotypes of who uses drugs and who doesn't use drugs. So I guess that's kind of roundabout, but it's just letting people know that drug users are all around us. We are everywhere, and that we all use drugs for different reasons, and that we all have the right to do so and the right to be safe in doing so as well.
I think a good way to kind of do it is also, talk to the audience that you're talking to. So the audience that you're working with, I would say most populations have a benefit from harm reduction use. And so knowing what audience you're talking to and what sort of values they sort of hold highly. In the work that I do, the people I work with tend to value the finances quite a lot. And so talking points around, harm reduction is a cost saving measures can sort of make it a bit more accessible for people who may not want to, grab on to harm reduction as a whole. Because really, any which way you sort of go, you can have benefits from harm reduction. You might just have to, look a little bit deeper into the whole principles of harm reduction for that. So speaking to your audience, that's usually what I do to kind of help with that side of things.
And kind of bringing in ideas that might make more sense to them. Like Bryce mentioned, we drive cars to go places, and we're not going to stop driving cars because there's a risk of getting in an accident, right? So, wearing a seatbelt is harm reduction. Making sure you maintain your vehicle, that's harm reduction. So you could use that in a whole variety of contexts that make sense to different audiences and make sense of harm reduction for them.
I throw this question in because I think it kind of has a thread to this too as well. Somebody asked, I love how using substances for pleasure is entering the harm reduction conversation. Do you think there is a risk of creating another stigmatizing dichotomy of people who use drugs for fun versus people who use drugs because of dependence? And if so, how can we mitigate this? You could look at it, Tim Hortons. Everybody in there is using drugs to feel better.
Yeah,
Yeah,
that's what I was gonna
Sugar
kind
and
of get at.
coffee, two
You
of the
need to
most
real-
ubiquitous drugs on the planet.
Right. And even people who are using, let's say, because they're dependent, physiologically dependent, that's still helping them to feel good, to feel better, right? To feel like themselves in a lot of cases. So I don't think that there's like such a gap there between like pleasure versus dependence. Because let me tell you, if you are dependent on a drug and then you don't get it, you're going to feel a lot of displeasure, right? And then when you get it, you're going to feel normal again. So yeah, I think it's more about reframing the conversation in terms of, people use to feel something. And I don't know, I lost my train of thought on that one, Bryce. What do you think?
That's fair. Well, I know if I don't get my coffee in the morning, I'm an asshole for quite a while there. And I would call myself as like dependent on caffeine because that's okay. We're all just trying to get through this life as best as possible here. It's not an easy world we live in here. So why is it so wrong that I want to drink my coffee in the morning every morning? Why is it so wrong that I want to smoke my joint before going to bed every night? It's like, who am I hurting by doing that? So
Right. And I'm seeing in the chat here that there's some good comments about Kat here comparing it to alcohol. We glamorize and promote its pleasure, sharing good times with friends, but like alcohol can also be quite problematic and can kill you. So I think, yeah, just not being so binary about some of these ways of using drugs.
Yeah, and that comment there, a thin line blurry between therapeutic and recreational. This was really handled very nicely with the Oregon Psy Initiative 109, is that therapeutic use is defined by the user. And so if you are using it therapeutically to become a better musician, that's fine. That's therapeutic use. And so that might be recreational. That might be, I am therapeutically using it to become more nature oriented, or just not to be an asshole. Excuse my language. All of those can certainly fall into therapy. If you're using a substance to feel better or to be a better person, then who do we really want to create strong a box that you have to be in this box for that to qualify? I don't know, and I'm just throwing that out there as food for thought.
Mm-hmm.
But Oregon's initiative that comes into has legalized psilocybin, has taken that into consideration, that as long as you're doing it with a therapy intent, the reason for your therapy is your own, which is your own right to your own consciousness.
Bryce, that was our last discussion piece, right?
yeah, that was our last discussion piece.
All right.
Well, there's some great questions here. Let me fire them at you guys.
Yeah, for sure.
Do you want to stop the share screen so everyone can see you a little bit better?
Sure, thank you.
That'd be wonderful. Thanks everyone for sticking around. This is so great. Another question here. Are there any psychedelic harm reduction and integration practitioner associations we can join, established ethical codes or statements to adopt?
Not off the top of my head that I know of. No, there's lots of organizations that have put out statements of support for like harm reduction and things like that.
Like Zendo, Nest, those are some more on the psychedelic realm. Then of course the organization that you're with, Bryce, we can put that in the chat again.
There you go, Project Safe Audience. We have some stuff out there.
And the HRNA has a great joint statement the Harm Reduction Nurses Association, along with the Canadian Nurses Association and the Canadian Association of Nurses in AIDS Care. That's a mouthful. They have jointly put together a supportive document about harm reduction, and it's just fabulous. Yeah, I actually feel like the link between psychedelic assisted therapies and harm reduction is pretty new. They're kind of like two separate fields that have only just recently started talking, in my opinion. And some of us like Bryce and I have started to like cross over into the dark side. I mean the light side. I don't know.
Well, I mean, the festival scene has had harm reduction for a long time. Zendo, Nest,
Mhm.
you know, they really had that set up. Burning Man has had harm reduction forever.
Yeah. And well, I got into harm reduction from music festivals. Like Shambhala Music Festival out in BC has a beautiful harm reduction program out there, and can't say enough about that program. They got on-site drug checking. They have a psychedelic chill space, and so yeah, it is interesting that some of these festivals have some pretty intense psychedelic harm reduction programs built into it.
And you know what's really
anchors.
quite,
Yep.
You know what's really actually quite really nice too is when my first degree is criminology, and the first time I ever heard about harm reduction actually came from a retired RCMP who had retired, and he was spending his time going to raves doing drug checking because he had seen the harms of it. So, you know, like again, you know, we're all community. Like there's no dichotomies here. Like people generally want to see people safe. And I think we're seeing that trend, and there's always some outliers, but let's just bring them into the fold. We'll call them in. Thank you. How do we include harm reduction in the way we market and advertise ourselves and our services? I'm not sure what services exactly is there, but generally, how do we advertise harm reduction?
I think I'm cautious about advertising yourself as like a harm reduction practitioner. I feel that's something that should come out in your practice, and you know, people should realize you're a harm reduction practitioner by what you do, not so much because you say you're a harm reduction practitioner. So I would exercise caution about advertising yourself as such. That kind of rubs me the wrong way, but that's just me.
Yeah, I feel like it's not a situation where you can like just put a rainbow flag on your website and you're good, you know?
Yeah.
I think a lot of it's going to come into the informed consent that you are getting from whether it's like, you know, research participants or patients or clients, realizing that, you know, as long as you're giving them complete information about that there are risks involved, but I'm going to do my very best. These are the steps I've taken to mitigate those risks. And if you want to go a step further, this is what I'm going to do if any of these things happen. I think that goes a long way to making your patient feel that you're taking their health seriously. And that would be a harm reduction approach for sure.
Yeah, absolutely. And I think that ties into another question here about therapy and training and et cetera, and how do therapists get these sort of skills? The reality, in at least as it pertains to psychedelics, is that, you know, eventually, and I suspect the way that psychedelics is moving now, it's moving so fast, is that every university and college that has a psychology or a counseling or a psychiatric residency will be teaching this by 2030. I'd be shocked if the vast majority didn't have some sort of psychedelic programming. I know next year, Vancouver Island University is launching a program there for people that already have degrees to build upon. And of course, those that have hours can apply to be grandfathered in to join the program. University of Ottawa additionally is doing a master's program in psychedelic medicine, again, launching next year. So we're seeing the academic institutions moving in. Quite a few academic institutions have done one-off courses. I think Trinity Western did one. I think Royal Roads has done one. I'm sure there's some other, University of Ottawa did 3 courses last year. So I think keep an eye out for there, and, you know, call up your closest university or college and say, when are you going to start offering some psychedelic medicine training? And I think this is a logical skill to add on if you are already a nurse, a physician, a social worker, a therapist, a chaplain, somebody in spiritual services. I think there's a lot of people that already have the skill sets, because you don't really per se train to become a psychedelic therapist. What you do is you have a skill set, and then you add psychedelic therapy as a tool within your skill set. So you have to have skills first. You just don't go train. And there are other training programs in the US. There's CIIS, there's the MAPS MDMA training. There's a number of smaller places that are doing more targeted training towards nurses and physicians, such as Fluence and Prodi. And there's a lot of things. So if you are working in the underground, what I would say is move towards getting credentialed, because this will be a credentialed calling occupation, and you will then be held to those ethics and standards and licenses and regulations, and you will be able to have your license taken away if you misbehave. And I think that's really where we need to move to, that there's a way for discipline and licenses to be removed and people to look you up and see that you actually have credentials and you have skills to. So a long way of saying is it's inevitable. It's coming. Stay tuned, get your skill sets up. And this is the world we're coming into, where psychedelics are coming back into being. Oops, sorry, I'm supposed to ask you questions. Sorry about that. Oops. Let's see. Does a lot of these are about CPA. Let me see. I'm interested in trauma-informed care. I find it alarming that psychedelics are not regulated in any way, and the practitioners are also not regulated. I know of many charging 2,000 plus. Bryce, you mentioned that, per session without any formal training in trauma-informed counseling or psychotherapy. Trauma-informed does not mean reading a book on it. I'm finding that a market is opening up, and many that are not trained properly or are taking advantage of this. I find this unsafe for clients seeking help and wanting psychedelic assisted therapy. Do you have any thoughts on that?
I think one thing this brings up too is like the use of like buzzwords in marketing and all that, like using terms like, yeah, like calling yourself trauma-informed care, calling yourself harm reduction. That's great if you call yourself that, but like you need to, people will know you are these things if you show it instead of just, you know, plastering it on your website and everything there. And so, yeah, I would say I would exercise caution for people, you know, seeing those words and saying like, okay, is this actually what they're doing? Is this actually what they're doing in practice? Or are they just stating this on the website? There's lots of organizations I work with in my city that are harm reduction that couldn't be farther from the truth. They're increased quite a lot of harms. So yeah, be cautious about them. Yeah,
I think it kind of comes with the territory of, you know, people are going to use all kinds of buzzwords, and including harm reduction, and not necessarily know what that fully means for them or should mean. What do I think we should do about it? I'm not sure.
Yeah. There's not really a training course on being harm reduction. Like there's courses, but no, you're not going to be designated as a harm reductionist. Yeah.
Exactly. I mean, it's not a regulated title or anything.
Yeah, exactly.
Right.
Yeah, I would just hope that like, this kind of goes back to the groups, right? Like if my therapy group, like our program, the Roots to Thrive program that I'm part of, and my community thrives, that one does psilocybin and one does ketamine legally. We're a big team and we meet, and it's about that multidisciplinary team. So there's no hierarchy in our team. We have MDs, we have nurses, we have therapists, we have Indigenous elders, we have energy workers, spiritual care workers, and we're all learning from each other. And that's what I realize. That's where you really learn harm reduction. That's how you learn cultural appropriateness across many cultures. That's how you learn trauma-informed care, is by working in community with people. And so I highly recommend that. Work on teams, lean into the tension, learn from each other, ask clarifying questions, keep upping your game. You're never done. I'm never done learning. I have to learn for the rest of my career, and I want to. And the only way to do that is to keep leaning into things you don't know about and work with people that know a lot more than you do, so you can learn from them or learn from each other. So I think that is certainly, you know, that goes to the trauma-informed care, harm reduction, cultural appropriateness, you know, gender appropriateness, et cetera, et cetera. All we can do is lean in, be curious, and really keep learning here.
So Pam, Douglas asks here, does the CPA facilitate any accountability groups? And they find themselves in circles, but would love to connect with different levels of practitioners. There's one for you.
We don't yet, and we are going to. What we're actually going to do is create networking within the CPA membership. If you're on the CPA membership pages, what you will find within those is you will, in the near future, you'll find networking opportunities where you can meet people that are working near you. And it doesn't mean they necessarily need to be doing the same work you are, but you can still meet and talk about, you know, the high quality or integrity. What does that look like? And get to know each other, and even creating referral things, you know, oh, this person's doing really great work over there, so you should see them, and having these works are networking groups. So we're gonna that's actually been a high on our list of to-dos in the near future, so that people can come together and start finding alliances and even mentorship and apprenticeship, upward people that have much more experience helping guide people that are new to it. Thank you for asking that. The Oregon, I think that's just, if anyone really wants to dig into what Oregon's doing, Oregon Psy, it was Initiative 109. The initiative is published on the Oregon Psy website, and you can find it. It was for therapy. Therapy as defined by the person seeking therapy.
Can I just address in the chat, there's a question Allison asks, I'd like to ask if there are parent groups to support parents dealing with youth on harm reduction programs. Bryce, you probably have something to add, but I was just going to say Moms Stop the Harm is a really good organization composed primarily of parents who have lost their children to drug use or overdose or whatever, but a really good place to go and chat with other parents who've maybe dealt with some of those things.
Yeah, I would also say Moms Stop the Harm. They do a lot of work here in Manitoba, and so they're really good about that. But I would say most provinces have some sort of support group like that. Like we have Moms Stop the Harm, but we also have other sort of specific Manitoba ones. So it'd be like a quick, Google search, parents supporting kids using substances or something along that lines. You might be able to track something down there. I don't really have any specific examples across the country, but yeah, Moms Stop the Harm is a good place to start.
I think there's another one too in the US called Just Say No, which is but no is spelled KNOW, Just Say No, like no more. And it's a program for parents and children. It's taught to children, but there's also a whole book on it. I remember seeing that at a conference about 3 years ago. Just Say No, KNOW. No more.
I think that's from the Drug Policy Alliance.
Is it?
It sounds very familiar, but yeah,
Sure.
they do
I
have a
heard
lot
it.
of resources, so that wouldn't surprise me.
Yeah, great. It was great. I leafed through it, and it was really fantastically written. Very, talks just blunt, straightforward. Educate, educate. Anyways, we're coming up here to, we got about 5 minutes left. We can answer a few more questions. I just want to comment on a few things that you guys mentioned. Patient-oriented research, you guys mentioned that's patient-driven research. There, for any researchers watching, every province has patient-oriented research grants. So what that means is it's really research-driven from the patient's point of view. Of course, all research should be that way anyways, but it helps pay people, like, so that if let's say you are a researcher and you want to research harm reduction, and you have people that actually are dealing with harm reduction, that you can actually get grants to help fund that and make sure that those patient advocates are the patients who are advocating for what needs to be studied are compensated for their time. So really great projects all across Canada, patient-oriented research. And I just wanted, before we head out here, a couple more questions, but just want to ask you all, if you have an extra $10 in your wallet and you want to support the Canada Supports campaign, Deanna or James will put that in the chat one more time. This is the CPA advocating for you in Ottawa, talking to Health Canada to help move forward the bar on legalizing psilocybin, at least as a start, for those that qualify for medical assistance in dying, that if they can qualify for that, then they certainly should qualify for psilocybin if they so choose. So please consider tossing $10 to that campaign. We'd really appreciate it. We also have a membership drive going on right now. We'd love to have you as a member. We are almost a completely volunteer-driven organization, and we're working really hard for you. And well, we're all a community, so we're all working hard on this together. So Bryce and Dominique, you've been amazing. There's one. Is there any last? We're going to put this up with the show notes when this webinar goes. Bryce and Dominique are going to give us a ton of resources to put along with this. But any good sources for more information? Your website. Let's put your websites up again. Let's get those.
Yeah, there's also, I'm seeing that there's been a couple times people are asking for good websites to go and find harm reduction strategies for different types of drug use. Sebastian asked, could you talk a bit about harm reduction for yourself? How would you use psychedelics if you were alone? So I just want to put a couple resources out there for folks. One is, especially if we're talking about psychedelics and recreational use, Dance Safe has a lot of really great content on their website. The Trip Project, which is out of Toronto?
Toronto, yeah.
Toronto, yeah. What else, Bryce? There's so many.
Um,
Anchors.
Anchors, yeah, Anchor's good. We got some stuff on ours at projectsafeaudience.ca.
Right.
I think we're CA now. One I would really recommend is getyourdrugstested.com. This is actually a website where you can ship your drugs off to them and they will test it in BC using an FTIR, which is a pretty accurate piece of equipment. Downside of that one though, it has issues with natural products. So don't send them your mushrooms or your cannabis, it won't work. It also has issues with things that are on blotter papers as well. But any of the mysterious powders you come across, that's a service I recommend. It's a great service. It's free to access, and you don't really have to send a whole lot of your drug out there. It's only about 5 milligrams or so of the substance you need to ship off to them.
Yeah, maybe put that in the chat. The website. It's a good one.
All these websites will also be, when this webinar goes up, we will make sure we put all these websites under the link for the webinar too, just in case you miss it or you misplace it later on. All right. Well, thank you so much, you guys. What a fantastic honor it was to have you both here. You're so knowledgeable, and many more people will see this after from the recording. And thank you to all of you that joined us live. We really appreciate it. And I hope you all have a fantastic evening.
Thanks,
Go do
Pam.
some
Thanks for
harm
having us.
reduction
Yeah,
for
thank you so
yourself.
much.